Well, tonight we bring you part 3 of senior health correspondent Monica Robbins' series on the long, strange trip of psychedelic research that's happening now in Ohio.
Tonight, one woman's cautionary tale of why it's so important to not try these therapies on your own.
Chris Wade battled mental health disorders most of her adult life.
I was diagnosed with bipolar 7 years ago.
Over the years, she suffered multiple misdiagnoses and massive medication errors. Still, her depression remained treatment-resistant. She tried transcranial magnetic stimulation, or TMS, to stimulate her nerve cells to improve the depression systems, to no avail. Then the facility mentioned Spravato, a nasal spray FDA approved in 2019 for treatment-resistant depression. The drug is esketamine, made from ketamine, an anesthetic long used to treat depression. But esketamine is a more potent version.
I wanted to try it because people with mental illness are desperate. And if no medication is working, it's kind of like a last resort. Insurances don't cover, and it's very expensive. I did research on it, but I guess not enough because of the horrific experience that I endured.
Ketamine and esketamine are legal treatments in Ohio, but both can induce profound psychedelic experiences and hallucinations. Spravato is only available through a restricted program called Risk Evaluation and Mitigation Strategy Program, or REMS. It has boxed warnings relating to side effects, including suicidal thoughts. Currently, it is not approved for bipolar patients. Chris never should have received it.
Bipolar disorder, which can sometimes cause mania or psychosis. There's a danger there that psychedelics can exacerbate psychosis or bring about mania or psychosis in those people.
When Chris received her 4th treatment, a higher dose, she had a horrific experience.
I had suicidal thoughts, and within like 5 minutes, I was thinking I was going to have a heart attack. My heart rate went up to like 160. Blood pressure was 160 over 110. I couldn't move. I totally was like frozen. I felt like I was in a cement box. I couldn't speak. I couldn't hear. I was hallucinating.
A healthcare professional checked on her, but Chris couldn't communicate anything was wrong.
But when you remove components of that protocol and you, for example, just give someone a dose of ketamine alone in a room, I think it'll be very unlikely that they would experience a therapeutic benefit or a lasting therapeutic benefit, and it actually increases the potential for harm.
Chris doesn't want anyone else to have this experience. She's kept records, reported her experience to Spravato's manufacturer and insurance company, as well as others. Experts say it's important not to try these treatments on your own. Stick with one healthcare provider who knows your medical history and can guide you through new options now available. At the time, Chris did not have a psychiatrist treating her.
When you are talking about newer treatments that are expanding pretty rapidly, you might see some of these variations in how people follow guidelines. It is tricky to kind of navigate that for an individual. So when you're trying something new, it's not terrible to ask multiple people about what their opinions are.
Monica Robbins, 3 News.
Of course, you can find all of Monica's reports this week on psychedelic drug therapy on our website, WKYC.com.
It's been a fascinating series.
It sure has. 3-part series and a very good one.
Yeah, learned a lot here.